March is Colorectal Cancer Awareness Month, and joining us to help spread awareness is Dr. Earl Natancho. This segment is sponsored by Highlands Oncology. Welcome.
Yeah, thanks for being here.
Thank you for having me.
Of
Yeah,
course.
absolutely. Let's start with this. What is colorectal cancer?
So colorectal cancer is cancer cells that grow inside the colon, which is the lower part of the digestive tract, and the rectum. We kind of put the big umbrella of colorectal cancer to also include anal cancer, which is part of the anus as well.
Yeah.
Okay.
Okay, good to know.
Any symptoms that people would experience?
So colorectal cancer is the big reason why we're pushing for screening is because most of the time colorectal cancer does not have symptoms.
Okay.
It's asymptomatic. However, there are some symptoms that people can experience, such as rectal bleeding, change in bowel habits, like if someone is more toward the constipation side versus more toward the diarrhea side, unexpected weight loss, increased fatigue. If you go to your doctor and you get checked and you're found to be anemic, meaning your low blood count, that's something that should be investigated. Abdominal pain, rectal pain, abdominal cramping. So any of these symptoms, especially rectal bleeding, everybody always kind of attributes that to hemorrhoids, and
Right.
it's not
Yeah,
always,
sure.
and it's not always hemorrhoids.
Yeah.
Okay.
So definitely get that checked out.
Yeah. What's a treatment plan look like for someone that you are working with?
So the treatment plan is really kind of divided depending on which part of your body your cancer is located and what kind of what stages we're talking about. So I usually like to talk to my patient and divide and split it up into colon cancer versus rectal cancer, and to some extent versus anal cancer. For colon cancer, really the treatment plan is twofold.
Okay.
Chemotherapy with immunotherapy versus surgery. Whether or not those patients will get those two treatments really will depend on what we like to call our clinical staging or pre-treatment staging. So when I see a patient that's been diagnosed with colon cancer, we stage them, pre-treatment, and then depending on that, it'll determine whether or not they'll get chemotherapy versus surgery. And the big message is early treated or early found colon cancer can be treated with surgery cancer and a good curable rate. With rectal cancer, you can add on to that, possibility of radiation therapy.
Yeah,
Okay,
for sure.
okay.
I love that we're talking about this because we're sort of destigmatizing and raising
Absolutely.
awareness around it, right? I feel like
Absolutely.
a lot of people probably struggle
Absolutely.
at home and don't let everybody know,
Sure.
and before it's getting to where it's going to be too
Absolutely.
late. So early detection is important, and coming
Absolutely.
to see professionals like yourself.
Absolutely.
And also raising awareness too. You've got this 5K coming up. What are the details
Absolutely.
on that?
Absolutely. We're so excited. This is our first ever 5K for colorectal cancer awareness month, because March is colorectal cancer awareness month. So we are going to do a 5K. It's going to start at the Highlands campus in Springdale, which is the big building off Exit 70 is what I tell people. We're going to start there. We're going to go around the Arkansas Children's Hospital and come back to Highlands. Some of us will be strolling, but if you want to run and if you're a runner, go for it.
Yeah.
There
Jason
will
is
be-
a runner,
There
actually.
you go.
Hey, I run all around right where you're talking about. That's my
Please
jam.
come and run.
Yes.
We will be watching you from afar and
Cheer me on.
cheering you on, but really to just kind of bring awareness and destigmatize exactly.
Sure.
I talk to my patients about poop is not a dirty word. Just like you say you have a headache, you can say you have constipation, and
Right.
that's quite
That's fair.
okay.
Yeah,
Yeah.
that's great.
So it's good to kind of start talking about this and getting people aware of it.
Yeah.
Sure.
Yeah,
And
absolutely.
registration is still open. People can
Registration
register
is still open. It's going to be March 30th, Saturday, March 30th. It's going to start at 7:30. We're going to make it a family event. So there's going to be some coffee, some breakfast, some snacks, some bouncy houses, face painting, fun things for the kids. My kids are going to come and celebrate as well. And we're going to start really the run and the stroll around 9:10.
Okay.
The runners are going to start first.
Sure.
And
Gotta
I'll be in
release
the
them.
back.
Yeah.
Strolling.
Strolling.
Yeah, that's fair.
We will be
That's fair.
strolling.
Something for everybody. The whole family can come out.
Absolutely.
Yes.
Yes.
And we've got actually a QR code right here
Correct.
Yeah.
on this poster board. You can just scan that to register right there. We can hold that for a second. If you want to go ahead and scan to register and meet us out there.
Yeah, for sure.
March 30th.
That's
Absolutely.
the date. Thank
Yes.
you
Thank
for
you
Thank
so much
you.
for joining
Thank you
us
for
today.
having me.
We
This is
appreciate
great.
you.
Yeah.